All right, welcome to the MMA live webinar on workplace safety featuring Sean Egan, Deputy Director of the Department of Labor and Economic Opportunity. I'm Mike Johnston, VP of Government Affairs at MMA. So let me start out with some housekeeping stuff. This is a Microsoft Teams meeting, actually a webinar, which means everyone is muted. However, we encourage you to send in questions throughout the presentation using the QA function. We really want to make sure we're addressing your questions, and truly this is your opportunity to ask the top regulator the questions that you want to ask. And we may filter a little, but seriously, it's your opportunity to ask the top regulator the stuff that you want to know. So let's get started. We're honored to have Sean Egan with us today to talk about workplace safety and the state's efforts to monitor and enforce workplace safeguards established in Executive Order 2021-14. I want to give you a robust introduction of Sean because he has a very interesting background and a large responsibility. Sean is Deputy Director of the Department of Labor and Economic Opportunity. He oversees MIOSHA, Workers' Disability Compensation Agency, Bureau of Employment Regulations, and Wage and Hour Division. So here's his background. He served in the Navy, then he became a journeyman electrician through the IBEW. He served as a shop steward and president of the local, then moved to West Michigan, where he was elected head of the local union representing construction electricians, manufacturing, broadcasting, and electric motor service industries. He also served on the board of the Heart of West Michigan United Way. Somehow in the middle of all that, he earned a bachelor's in business administration from Davenport University and a JD from Thomas Cooley Law School, all while raising 3 children with his wife, Christy. I mean, just an amazing background. Most recently, Sean was appointed by Governor Gretchen Whitmer as the Director of COVID-19 Workplace Safety and is responsible for coordinating the state's efforts to monitor and enforce workplace safeguards that were established in Executive Order 2021-14. So with that, let me hand it over to Mr. Egan so he can talk about workplace safety requirements, the department's approach to enforcement, and resources and tools available to employers. Sean, you have the floor.
Well, thanks so much, Mike. I really appreciate the introduction and the reference to my background. I know that list is a little bit long. It feels weird at times to look at it myself, and you kind of think of like where you are in life, and you just keep moving forward, right? So yeah. It's great to be with you all. I love talking with everybody all the time about this. I know that we're all working very hard and very diligently to try to navigate this COVID crisis. I always have to keep in mind that we're dealing with a public health crisis that certainly impacts workplace safety. I know that for many of you and many of the members of the MMA, you probably were operating through the stay home, stay safe order, and you were among the first to kind of come back online as the governor started re-engaging the economy. But just a real quick recap, there is a lot of noise around COVID. We have a 24/7 news cycle. I know it's challenging to keep up with what's happening, but some things are staying the same. So how it spreads, right? We know that it's primarily from person to person through large respiratory droplets or aerosols that we generate. When all of us talk, we know that whether we like it or not, we're expelling things out of our bodies that can move the virus from one person to another. So as you know, early on, there was a lot of push toward face coverings, physical barriers, social distancing, and other tools to try to make sure that we're not allowing the virus to spread. When we wear those face coverings, which if you're on anything with me, you're going to hear me talk about all the time, it can really cut down on the distance that these droplets and aerosols can travel to the point that we really increase our safety between each other to a huge extent, and it's going to be a primary vehicle moving forward. Now, having, as you heard, worked in many a place over the years, I know that it's hot inside a lot of these plants, that folks don't want to wear face coverings, but stay strong, stay committed, because that's going to be a key to making sure we keep COVID out of the workplace. So we have a lot of tools that we've been developing, and one thing I like to touch on briefly, because it needs to be mentioned, is on enforcement. So we've gotten a lot of questions over the months of what is MIOSHA enforcing, and I'm happy to tell you that From the beginning of this crisis, MIOSHA has been using the general duty clause, which every employer has a general duty to provide a workplace that's free from recognized hazards. Obviously, COVID is a recognized hazard. They have been using the general duty clause to enforce the CDC guidelines and then as developed the executive orders. So we've been working with employers nonstop and workers on what that means. We know that this is a learning tool. We've had a lot of our complaints have skyrocketed. About 20, so we moved from about 200, 240 a month to about 1,000 a month in complaints, and MIOSHA is responding to all of those. We have been working with employers to make sure they understand what they're supposed to be doing, as well as the tools that they can use to make their workplaces safer. And I, have told Mike that, up to this time, we have not issued a citation. We're getting 90 to 95+% compliance, because we're all learning through this. We know that all of you are working hard to know and understand what these requirements are, but they're a moving target at times, and they're very broad. So we have some great tools that we put together to really help in this too, and this is one of them, making sure that we're available and accessible, which we are. Many of you have worked with MIOSHA over the years. Certainly as it comes to workplace safety, MIOSHA will continue to be the primary vehicle that out there making sure that workplaces are safe and employers have the tools they need to provide those safe workplaces. So Executive Order 114 includes a lot of very specific workplace requirements for all types of employers. We are enforcing that executive order through the general duty clause. I know that there was some question because of the court case that targeted two specific provisions in there related to MIOSHA, but we have been and continue to use the general duty clause for the executive orders as well. With that, we have a dedicated website, michigan.gov/COVID workplace safety, which Delaney will share the link for you, that we have created, MIOSHA created guidelines based around the CDC and all of the executive orders that have been released. And there is a guideline for every industry that's been named. Manufacturing certainly is one of those. We also have general industry guidelines for those workplaces that have not been specifically named in an executive order. And those have been up for some time. I would imagine that many of you have taken a look at those. We know that many of you worked on the work groups that the governor put together to develop best practices. We do also have those available at Michigan Leo. We have sort of separated the two because we know that many employers look at both what do I have to do as well as what can I do. And with the MIOSHA one, the Michigan Workplace COVID Workplace Safety site, we decided to focus specifically on the MIOSHA pieces so that you know exactly what they'll be looking for when they come into your workplace. Among those things that you have to do, we know is a health screening for your employees. If you're familiar with MIOSHA, the first priority is always to try to eliminate the hazard, and the health screening is an attempt to try to keep COVID out of the workplace, which means all of those other things that you're doing, physical barriers, face coverings, staggered shifts, all of those pieces are more impactful because we're going to try to keep that sickness right out of the workplace. DHHS has built a very powerful and valuable tool for all employers. It's free. We have a link to it right on that website I mentioned, which is the My Symptoms app. If you haven't heard of it, I'm going to explain it briefly. If you're using it, feedback's always appreciated. So the My Symptoms app is essentially a health screening questionnaire. Employers go in, they click on it, you set up an employer account. It's just name, information, etc. A contact person that's going to receive the reports on who is taking this health screening, as well as it has, if you get a positive COVID test, it has the reporting function of public health as well built into it. The health screening is just a few questions. It's basically the same questions you've been seeing. Do you have a fever, cough, runny nose, new symptoms like that. What will happen is after you set up your account, you'll get a number that's specific to you as an employer. And you will then set it up. Your employees can use their own smartphones or a desktop computer or whatever else to log in. They use that number to connect directly to you, and they basically take the questions. We're building a portal. One challenge we have right now is that the report on employees that fill out this or using this app comes the next day to the person you've designated. What will happen when they fill out the app is they'll get a green or an orange indicator based on the answers to their questions. Green, of course, means they've passed the screening. Orange means that some flag has risen. They'll get a notice that says contact your supervisor, do not report for work, you know, that kind of stuff, and contact your medical provider to discuss these symptoms that you're having. All you need to do to be in compliance with the health screening requirements is just keep a log of folks coming in and showing you the green screen. You know, Sean showed up, green screen, Sean, you know, whatever. And you're good to go with that portion of it. The only challenge in manufacturing is that in Executive Order 114, it's the only industry listed that requires a temperature screen if no-touch thermometers are available. Now, you know, I haven't heard back from a lot of manufacturers on whether or not those no-touch thermometers are available or not, but that is listed in that requirement as well. So if you're doing that, you know, keep doing that. We always want to avoid congregation points. I know that you're all paying attention to that. We want to make sure that all of our employees coming in don't bunch up because they're going to have to do a temperature screen. So you have to navigate that the best that you can. We know from watching the news and the science that, you know, congregation, getting within that social distancing, those other tools are really where the hot spots are created. And we have other tools on that website as well. So we have some videos, we have a talk over web presentation for both employers and employees on the general industry guidelines. Most of the guidelines in manufacturing are, you know, those general industry guidelines as well as the specifics from the executive order. We have some posters and flyers you can use. We're constantly updating there. So if you are looking for updated information or new tools or resources, that's where we're going to put them. We got a couple of minute video on manufacturing with some more of the specifics on there. It's built in a more social media friendly way, very plain English to make sure that, you know, some of these basic pieces people can understand. We have a link over to the Michigan Economic Development Corporation's Peer Michigan Business Connect program. Some of you are more than likely already participating as manufacturers in that. It's also a platform that employers can use to get the PPE and other things that they need. And I've talked with the MEDC to make sure there's capacity there, and they said absolutely. They have a couple of thousand Michigan manufacturers, which is awesome, that it's Michigan based, that are providing barriers, face coverings, you name it, hand sanitizer. If you're looking for that stuff, I would encourage you to go check out that link and try to get over to the Peer Michigan Business Connect to find it from other Michigan manufacturers. We're doing some social media safety snapshots, we call them, that are coming out of the department itself, where we'll have just a couple of high points on different industries. We do have one out there for manufacturing. You can certainly share those. All of those are right on that website if you want to try to do that, just to help spread the message. So we're working hard to give you the resources you need. We appreciate these opportunities so that you can share with us other things that you feel like you need, so that we're constantly in development. As I mentioned, this is a constant learning process. So we're trying to just stay up to speed as quickly and as efficiently as we can and respond to things that we see out there. One of the pieces that's coming up more recently that I did want to just touch base on briefly is paying attention to indoor air quality. This is probably going to be more of an issue in offices or restaurants or gyms or things like that. As manufacturers, you know, many of those buildings are quite large. Spacing is quite good. Ceilings are quite high. You know, open the windows, get the fresh air moving. But we have posted some information from ASHRAE. So if you're an engineer, you probably know a lot about ASHRAE. For everybody else, it's basically the industry experts that when it comes to HVAC and other tools, they've developed some specific COVID resources that you can consider. We don't have a requirement for them, but to consider. One of those is finding air filters with a MERV rating of 13 or higher. If you're on this webinar and you know what a MERV rating is, congratulations, but it's basically an indicator of how much that filter can filter out. 13 or higher can get small enough that it can filter out a lot of the particulate from COVID. It's not perfect, but it does help. I know one of the pieces says consider HEPA filters. we know that, and it's considered, right? We know that HEPA filter is actually the top MERV rating. It's, you know, it takes out more than anything else. But for many mechanical systems, it's not something you can just go stick in there and you're going to be fine, because it does have a very limiting effect on the circulation. So we have those on our Leo website main page, right under best practice guidelines, that you can link. You can check out the link over to ASHRAE to kind of touch base there. I know that you're all aware, because Mike has asked me 17,000 times about MIOSHA grants that just became available in Senate Bill 690. We've been working on this for a while. If you are not familiar, MIOSHA has a My Wish program that we do every year. We normally have about $250,000, and that is a matching grant of up to $5,000 that goes to employers to help with purchasing PPE and other things for their workplaces. Through the CARES Act, as you know, the state got a lot of federal funding, and we were able to work with SBO and the Senate and legislators and the governor to create a grant program specifically for COVID-related PPE, safety needs, you name it, similar, and we're going to operate it similar. So the parameters are, it's for businesses of 250 employees or less, similar to the My Wish. It'll be a matching grant of up to $10,000. We had talked about maybe moving that a little bit, because it's not required that it's 10, but we decided just to run with the 10. We know that many of the proposals come in much lower than that. We are looking at, you know, you can't have outstanding MIOSHA penalties. That's going to be rare that somebody's going to run into that, because you can't use grant funds to pay for penalties. In theory, if you have an outstanding penalty, you could, right? So that's one. We're looking at how we can possibly bucket it. As I mentioned, we normally do about 250 grand. This one is up 8.55 million in funds that MIOSHA has to distribute. So what we want to try to do is make sure that we target industry sectors by employment for the first couple of months to ensure sort of an equal distribution of available funds across industries. So we're going to look at the LMI data, you know, and kind of map out, you know, what percentage of the workforce is in manufacturing, what percentage is in retail, and kind of create buckets out of that 8.55 based on that. I don't have the exact numbers for you right now. It's still going to be significant sums. We're thinking we'll do that for the first month or so, and then just, you know, stick it all together, just to make sure that we get some kind of equal dispersion across industries. We're shooting for a July 13th kickoff for that. We're still finalizing the brochure and the application. It's going to be pretty simple, not a lot to it, but one of the things that I was talking with MIOSHA about yesterday is that for grants from the state of Michigan, you have to set yourself up in the state of Michigan Sigma system. It's not hard to do, it doesn't take long, and there will be a link to that information in the grant, both the brochure and the application on how you do that. It's a tracking tool, and it's something that we have to do. So just be prepared to do that if you're not already set up in the Sigma system. So what we're going to do when that launches on the 13th is right on that same website again, Michigan COVID Workplace Safety. We'll have a link right there, MIOSHA grant program. It's for PPE or anything. You know, we've had some questions about hand sanitizer. Absolutely. We know that some places have bought these foggers. I don't know if you've seen these foggers, but you can sanitize your whole space using a fogger. That'll kill the virus, you know, that kind of stuff. Absolutely. Barriers, absolutely. PPE, sure. We're gonna work on a sort of first come, first served basis. MIOSHA does do a review. We're not going to really make a judgment about why or what you're asking for, but certainly if it's some sort of example I shared with Mike is, you know, if you have 50 employees and you're requesting funds to buy 20,000 face coverings, we're probably, you know, it's probably going to be a question or maybe not an approval. But you know what you're doing. You're going to have to do a site-specific evaluation to your workplace. You know, it's a grant, right? So you're going to have to do a site-specific evaluation of your workplace, put in there what you need and why. It's going to be a matching grant, so you're going to have some skin in the game, and we'll move forward and as quickly as we can. Because it is a reimbursement grant, normally you have to have expended the funds already to get the grant money. So I would anticipate that being there as well. And at MIOSHA, don't forget, never forget, if you haven't used them, we have a wonderful consultation team over there. always available. You go right to MyOSHA's website. There's a link right on the left side that says consultation team. You can request these folks, these MyOSHA experts, to either via phone or come right to your workplace and kind of help you evaluate what you need. They're very smart, very accommodating, and they will work directly with you to make sure that you identify and can do the things you need to do to make your workplace safe. I almost forgot one thing on my notes I skipped over, is that we also have a hotline available. It's 855-SAFE-C19. Delaney will share that with you as well. 855-SAFE-C19. We set that up. That goes directly into MyOSHA. It's staffed by MyOSHA folks. It's not an external call center. We have about 20 people available to answer questions. That's available to both employers and employees for any questions related to COVID and things that you need to be doing. We're working on our call menu because it doesn't say specifically right now, if you're an employer, press this button. Just press the button and they will help you out. If you're an employer and you're having these questions and you can't get them answered there, they will get you over to the consultation team and start working through that process. For employees, similarly, but if it gets to a point, they'll move it over to the complaint process and work it that way. We've also set up a public referral that folks can use into 855-SAFE-C19. It's a little bit new for MyOSHA, but we're working through it. We're getting a lot of calls about gyms being open where they shouldn't be. I went into the restaurant or whatever and nobody's doing anything. Those kind of issues, and we have a process that we will use to kind of work through that. But don't forget about that consultation team. Make sure you use them. We have a multitude of resources available. Everything, we're trying to make sure it's everything you could ever want. So make sure you tell us what you want, and keep these face coverings going. Like I said, we know it's hot. We know they can be a little bit miserable, but it's what we're going to have to do to keep it going. I normally use the phrasing with the retail side. It's get open and stay open, right? And these are the things that we need to do to make sure that we do stay open. As the governor has mentioned, that Safe Start plan moves in both directions. So, and as well as I do, the governor has shown that she will do what it takes to protect Michigan families. And certainly we want to be in a position that we keep things open. So for all of you, when you go out and about, wear the face covering. It's the #1 tool that we have to help slow the transmission of COVID and make sure that we're all staying safe. I was going to share my screen just to show you that web page, but I kind of blew past it. If you'd like me to, Mike, I can. Otherwise, we can just kind of move into the Q&A. As you can tell, Mike, I've developed into quite the politician and can talk forever now. So I think what I'd like to do is just sort of stop there and open up for Q&A.
Yeah, thank you, Sean. I think questions are probably the most important part of this, so they can pepper you. They don't know you, but we have guards outside your door and won't let you leave until you've answered them all. So, good. But the first question that popped up on our screen is MyOSHA SET division offering assistance to companies to ensure that they are meeting the requirement related to COVID? And I think this question is as much about that question of enforcement versus education. Maybe you can address that relationship.
Sure, absolutely. I think absolutely. I think absolutely. The answer is absolutely. SET is that consultation team is offering advice, guidance, tools to employers to help them. I didn't hit on it correctly. I think we talked about it, but our goal here is to educate, educate, educate. Certainly, MyOSHA has that enforcement tool, but we're not out there running around with a hammer, especially with COVID, because we're all trying to figure out what to do. So we are out here all the time trying to have discussions, call the hotline. SET is available to answer questions and work with you. We're trying to make sure that the tools are there so you can understand what you need to be doing. And that is absolutely what we're trying to do. Educate, educate, educate. Both employers and employees. It's a challenge and it's big. MyOSHA is about 200 people and there's about 235,000 workplaces in Michigan. So it's not as though we can just start knocking on doors, but we're trying to build all the pieces so that we do that. Great.
Then we had another question about the grants and how you access it, and you talked a lot about that already, but I guess it's worth talking about saying, look, this is first come, first serve money. It's available starting July 13th. That's next Monday. So the big question is, how do people apply? because they better get applying now, right? Walk through that again about where they get the application and when they submit it. Do they submit it on the 13th and then you begin to evaluate, or could they continue to submit? Frankly, my advice is to submit on the 13th, but can they submit prior to the 13th?
So the plan right now, Mike, as you know, like we just got this and it's still working through some of the SBO stuff on how you do some things, which is why we're choosing the 13th to launch. I would say we've already gotten a number of grant requests through the MyWish program, which is not the right place for these, but it's okay. We're not going to exclude those folks. So if you already applied through there, we're going to just kind of put those in this bucket. And if there are any additional parameters, which I don't think there will be, it's very, very similar to the application for the MyWish and this COVID grant program that we're doing. So we're not going to exclude folks that are applying now, but our goal is to just launch on the 13th. The application will be right there, and people can just start applying right away to get the funds. And then I know the next question is when will they be dispersed? So when you apply, MyOSHA is going to look for basically an invoice that says, I bought 20 gallons of hand sanitizer or something like that for however much that is. It's probably about $1.5 million right now. Just kidding. I bought 20 gallons of hand sanitizer for $400. I'd like to be reimbursed. So you get if you approve, you get the $200 back. So they'll be looking for that to make sure that the expenditures actually happened. That's one of the reasons we like the matching grant. I know that it's hard. We know that employers are fighting to get through and everything else, but as you know, if it's just sort of free money, it's harder to make sure it's having the impact that we're hoping to have with it. So that's the plan. So on the 13th, hit the link, apply right away, and you can keep applying down the road. If you've already put one in, we're not going to toss it out or anything or make you reapply, but the pathway just for the COVID money specifically isn't there right now.
Okay, that's helpful. So here's another interesting question. Do you expect COVID workplace safety requirements will continue to be organized in the executive order as they are now, or will they become some part of MyOSHA rules going forward?
So I believe that for the for the near term, they'll absolutely continue to be in executive orders. And part of the reason for that is just the rapidly changing environment that we're continuing to deal with. All of you are continuing to deal with, and being nimble, flexible, pulling things when it makes sense, putting things in when it makes sense, because, like we said, there's a lot of noise in the science. I always like to remind everybody it's a novel coronavirus, meaning first of its kind, which means none of us know exactly how to deal with it and none of us have immunities to it. So trying to navigate that. So I would anticipate that they'll continue to be in the executive orders. You're muted, Mike.
Muted myself somehow. Can you say whether the contact tracing efforts by DHS and local public health have revealed any COVID hotspots at manufacturing facilities?
To some degree, yes. So honestly, well, I shouldn't say that. I mean, so what we've seen a few outbreaks at similar to other states at meat processing, some agriculture, some food production facilities that we're seeing there. I have not been made aware of any at like a small manufacturer or anything else. Those are the only few that I've seen so far.
So let me jump back to the enforcement stuff, because I think this is really important in terms of manufacturing relationship with state and really the SET program and other staff. So you sort of indicated that your staff is going in with an education approach and not necessarily a fine designed program. I'm going to have you repeat it. How many fines have you issued so far?
So far, so I mentioned 1,000 complaints a month or so. It's actually trending down a little bit. So I think we hit about 800 in June. About 28% of those are coming out of the manufacturing industry. Now that number is a little bit skewed because we had a lot of complaints come in when the stay home, stay safe order went into effect, and certain businesses deemed essential were continuing to operate, from employees that didn't believe that their place of employment should be continuing to operate. So it's probably a little bit lower than that as a percentage. But from that, we've been conducting off-site investigations, D-letter investigations, remote processes, and we have not issued a citation at this point. That doesn't mean that we can't. We just are going in with these are the things you're supposed to be doing. There's a lot of confusion, so employees may have a different perception of what should be happening than employers at times, and bridging those gaps. But yeah, it's educate, educate, educate. So we have not, to this point, we've not issued a general duty citation for violation of the CDC or executive orders.
I think that's important information. So I mean, you truly are there to help, and it's always a joke. I'm from government. I'm here to help, but it has the added benefit of being true here. So thank you for kind of repeating that. Let me jump to the My Symptoms app. Some people have asked me, does that app automatically report stuff to DHHS, or is that a step, voluntary step by the employer?
I'm still navigating that piece myself. My understanding at this point, and I could be wrong, and I apologize for not knowing exactly, but my understanding is that if you get a positive, that will be reported to DHHS. And I think in the executive order, that is when you have to report, is when you have an actual positive. We know that in the workplace, you're probably going to have, we know we're going to have people that have symptoms that come down with it during the day. You need to get them out of there, keep them at home, be flexible, with your policies so they can get out of the workplace. Just those things until they're actually positive. I'm not sure if they actually go to DHHS. I believe it's just the positives right now. I'll double check that, Mike, and get you an answer that you can email out.
Thanks, Sean. There's another one that popped up. What's the best way to reach the CET staff, SET staff?
So the best way to do that in the short run, if you just have some questions and you don't really know or believe that you need somebody to come out to your place, use that hotline, 855-SAFE-C19. That'll get you right to the experts. They will talk you through everything that you need to do. If you feel like you need a consultation, just go to MIOSHA's homepage and click on the consultation tab right there on the left-hand side, and that'll get you right to their email and phone number.
Great. Let me jump to the ASHRA. I say I'm going to use the word term requirement, then ask the question. You indicated that it has a lot of information about filters and HEPA filters, and I've gotten calls from companies say, it's impossible economically to retrofit these kinds of things. And so the questions I always get, is it really a requirement? And anyway.
Yeah, no, it's not. It is not a requirement to have a HEPA filter in your HVAC system at all, and we understand that. It's in the best practices that came out with the Merck and others, it had in there consider HEPA filters in the ventilation systems, but we know that, and I know specifically because I've installed those things, that those systems are pretty prickly. They're designed a certain way. They're designed for certain filters, and moving from sort of maybe a mid-range filter to the top of the line, the system has to be reworked to be able to handle that kind of change. So there are other tools in that, so it's not a requirement, and there are other tools though that you should check out in the ASHRAE information we posted that has some other options, right? There's small space filtering units that you can get. Most HVAC systems, I believe, would be able to handle a MERV rating of 13 on the filter. It's just basically a higher grade furnace filter, so to speak. So you'd want to consider that. I know that many of them are prickly, so it's maybe not that simple, but there's a couple other pieces there too, like UV. They have some information about UV filtration that you might be able to install that kills a lot of that virus that could be circulating around. Those are generally not overly expensive. In some systems, they would be hugely expensive. I understand that, but there's not a requirement on ventilation other than trying to increase the fresh air inflow.
Yeah, so I mean, regulated community is always concerned about vagaries in the law, and when you say, well, if it, it's kind of not expected, not required, but we'll look at it. That's a really difficult thing. So anyway, I'm just kind of reflecting the frustration of our members trying to figure out what it really means.
Yeah.
So thank you for answering that. Let me jump back quickly to the enforcement stuff and the EO and the authorities being struck down by the court. But as you said at the outset, the general duty clause, you think, gives you the authority to use the full spectrum of enforcement tools and enforcement authority under MyOSHA? Question mark.
Yeah, absolutely. So we started one of the first in the nation, probably at the beginning of this crisis, putting out the CDC guidelines for workplaces and using the general duty clause as, if it were necessary, as the sort of stick to go along with the carrot, right? As I mentioned, we're not really trying to use that stick, but we do have enough teeth there if we need to. So like I mentioned, MyOSHA is having a lot of conversations with employers, and everybody, from our take, certainly there are probably some bad actors out there, but everybody's trying to do the right things, and they just need some help in understanding what the scientists are telling us are the right things at this moment in time. And like I said, we know that may change to some degree, but some of these pieces are pretty static now. Health screenings to keep it out of the workplace, barriers, face coverings to keep it from spreading. I mentioned to you yesterday, right? We don't need bulletproof glass to stop COVID from transferring. It could be a clear shower curtain, frankly, right? You're just trying to keep those droplets from getting to the next person. We know that in manufacturing specifically, and other types of workplaces, that moving people around is hard. You don't go in and move a 2 million pound press or whatever. you kind of have to try to navigate around that. So finding those other tools that can do that. But yes, the general duty clause is broad enough and strong enough that we do have that enforcement tool if we need it.
Thank you. I have one last question, and it's a kind of looking down the road question at phase 6. Because phase 6, as it's been laid out by the governor, says there will be some lasting safety requirements. What kind of stuff do you think that will be? I mean, recognizing the manufacturing has the most stringent list of activities and requirements, including as you mentioned, the temperature stuff. How much of that you think will continue for manufacturers? And if it continues for manufacturers, will it continue for other sectors?
So I am not able to really speculate on what the governor meant with continued safety requirements beyond into phase 6. I think it's just being prepared that we don't know how well a vaccine is going to work. We don't know how well some of these safety tools are going to work, or what's next as it relates to COVID. So my gut would tell me it's just, keep paying attention, because as we learn more, there could be more. But at this time, we don't have some long-term plan with a whole list of rules that we're going to have in place. It's just, I think, a ongoing process.
Good. Thank you. Oh, I see another one pop up on my screen. Where specifically can ventilation for ASHRAE guidance be found online?
So you can do this a couple of ways. We posted, if you go to Michigan Labor and Economic Opportunity, if you just Google Michigan LEO, it'll get you to the same spot. And right on our front page, you'll see some of our MyOSHA created guidance right at the top. If you go down just skosh, it says best practices, and there's some other industry created guidelines and things there. The ASHRAE information's linked right there as well. Or you can just go straight to ASHRAE. It's the national organization, but if you just Google ASHRAE, they'll pop right up, as well as their COVID resources. And they have a statement there which includes some of the things that you can do in different types of industries. Certainly hospitals have always had more stringent standards, so they do have some information there. But as you get through the document, obviously written by engineers, because it's like type 10 font, single spaced, that kind of stuff. No, but if you get down in there, you'll start to see some guidance that they've provided for manufacturing, for offices, for restaurants and others. that is less, right? It doesn't even mention, I don't believe, that HEPA filter. It mentions that MERV rating of 13 or better that I mentioned, and some other space pieces you can use, how you can increase the fresh air intake on your systems and things like that. So either go to Michigan Leo and the link's right there, or just go to ASHRAE and they have their COVID resources right there too.
Well, good. I don't see any more questions popping up. So let me first thank all those participating on this call and choosing MMA for your source of information. We've had, I think, 64 registrants for this call. So these are the kinds of webinars and information sessions that we want to deliver to members, and we're see that they are being well received. So we appreciate your participation. We've posted on the screen links to some of the information that Sean referenced, and certainly MMA's website, mimfg.org. So there's a lot of resources available. But Sean, seriously, thank you for taking time out of your day and sharing your expertise and spending time with our members and really putting a face on government, right? So this has been very helpful, and we truly appreciate your involvement.
I appreciate it. Thanks for having me.
With that, we'll sign off, but feel free to contact me with questions and we'll respond to them. Thank you very much. We'll gavel the session.